So I am very excited to chat with Bronte May as we are going to discuss common oversights with thyroid healing, including talk about emotional healing. It's going to be a great conversation. So let me go ahead and give Bronte's impressive bio here as Bronte May is a naturopath with a passion for thyroid health. She knows firsthand the multi-layered journey to heal from a thyroid autoimmune condition, having personally dealt with and healed from Graves' disease. She understands how healing the emotional aspects of disease can unlock deeper healing and how also mindset coaching can support this often challenging journey. Interweaving a myriad of modalities from her toolkit, Bronte facilitates healing on a cellular and soul level to create space for self healing. Bronte also offers an individualized 12-week one-on-one thyroid healing program and a 10-week group program where she guides you through steps and tools that work for herself and her numerous thyroid clients. Her programs are life-changing, and thank you so much for joining us, Bronte.
Thank you so much for having me here.
Yeah, this is going to be great. Very excited to chat with you. And yeah, before we get into the common oversights, definitely want to dive into your background. So how did you start? Well, I kind of gave it away a little bit in the bio, but we'll have you expand on
Mhm.
your journey just a little bit on how you're doing what you do right now.
Yeah, sure. So, quite a few years ago now, I was diagnosed with hypothyroidism. But knowing what I know now as a thyroid naturopath, I was actually misdiagnosed. I had high antibodies and they were just not really spoken about. I even pointed them out to my GP and she's like, oh, don't worry about those. And so then, fast forward 3 years after that original diagnosis, I ended up having a relapse and I was very sick, not knowing that it was my thyroid again. Until I did further testing and they sent me to the endocrinologist and I was diagnosed with Graves' disease. From that point there, they gave me some treatment options, which sounded very scary to me and nothing that I wanted to choose. So having my thyroid taken out or radioactive iodine, or they spoke about the risks of staying on carbamazole long term. So that felt very scary for me. No one explained to me what the thyroid was, where it was, what it did, how important it was. I was just sent off and said, look, you've got 6 weeks to make a decision. In that 6 weeks, I reached out to a friend who was in the medical industry and we spoke about changing my diet. So when I went back to the endocrinologist 6 weeks later, they said, what have you decided? And I said, well, I've decided to create my own fourth option because I didn't like the three options that you presented. And they were like, what do you mean? I said, I'm going to heal myself with food. And they told me I was crazy. But fast forward, that did help. That really helped. It got my antibodies down by changing up my diet. But with a thyroid autoimmune journey, it's not just about your diet. It's so much more than that. And that's what I discovered. And so through that journey, I became very, very passionate about health. And that's what led me to become a naturopath and teach other women what I have done myself. So, yeah, I just think that there's a lot of, it's almost like I see it as like negligence that the medical industry is not looking at the whole person. No one said to me, and I hear this from countless patients as well, no one's asking you, what is your lifestyle like? How are you feeling? How are you sleeping? What are your stress levels like? They're not asking about your toxins or your digestive, if you have any digestive issues or anything like that. They're not unpacking what's going on in your emotional body. They're not asking anything about your mindset, and all of these things matter. So yeah, that's what I'm passionate about in guiding my clients and teaching them about the different aspects and the self-empowerment piece as well. Hmm. To how to like
Yes.
advocate for. Yeah.
All right. Well, yeah, same here. I mean, in United States, I wish I could say endocrinologists were more open-minded, but sounds like they're the same way. I mean, they're dismissive of diet and lifestyle playing a role in the development of conditions such as Graves and Hashimoto's. And pretty much when it comes to hyperthyroidism, they give, yeah, the three options, antithyroid medication, radioactive iodine, thyroid surgery. So sounds like pretty similar in Australia. Yeah, not too many natural-minded endocrinologists.
Yeah, we hear it so much here that, oh, don't worry about changing diet. It's not going to do anything for your thyroid. Like your options are medication or removal, essentially, or like, shutting down your thyroid with radioactive iodine. So, yeah, like even when I went back and my antibodies went down, they weren't even curious to ask what I did. They was, oh, it's just luck kind of thing. And I was like, okay. So yeah, and I hear that from my patients as well. Or like, people who are inquiring to work with me, they're like, really, like my endocrinologist or my GP said that changing my diet's not going to change anything. And, how can I get off medication? How can I heal my thyroid? Is it actually possible? I get that question all the time. Is it possible? And yeah, it's so possible. So many people do it. Like you're helping countless people do the same thing as well. Um, yeah.
Yeah, and yeah, no, obviously we both agree. We both have experienced it ourselves and have helped many people. And I would say with the endocrinologist, yeah, I mean, I can understand that's just how they're trained, but I
Mm,
would like to think if I was an endocrinologist and even if I was a little bit closed-minded, you know, I would I would think would say, well, I'm not sure if diet would help, but you could always give it a try and change it. It's never going to hurt. If anything, it's always going to help to clean up your diet. But they don't even say that. As you said, they're very dismissive and just say, no, diet's not going to help at all. And these are the only two options or only three options. So yeah, it's very discouraging. But
mm.
again, I don't see it
And there
changing
are
anytime soon.
some, yeah. It just that the majority of them aren't even curious about it. But there are some good ones out there. I have had some of my patients that are seeing good endocrinologists. It's just few and far between, unfortunately. And I hope that that begins to change, because there's a lot of information out there. There's a lot of people waking up to understanding that there's more ways to heal than just the mainstream. So, and
Yeah.
maybe it's just
Well, let's dive into those common oversights. So when it comes to thyroid healing, and I like to start with iodine. So let's talk about iodine as one of the common oversights because there's a lot of controversy with iodine and thyroid health. Some people, say to take really high amounts of iodine. Other people say, you don't want to take any iodine when you're dealing with hyperthyroidism as well as Hashimoto's. And so yeah, what's your perspective when it comes to iodine in both hyperthyroidism as well as Hashimoto's?
Yeah, yeah. So it's very important in both of them. But there is a time and a way to introduce it. So the things that I'm looking out for both, obviously there's a little bit more caution when the person is hyperactive or has Graves. But in both cases, I'm always looking at the antibodies. So making sure that we can get the antibodies down to, a more reasonable amount before we start to introduce the iodine, and introducing it slowly, particularly for those Graves patients, and introducing it alongside selenium as well. So there's like a delicate balance in the dosage, and making sure that you do have enough selenium supplementation alongside the iodine. But yeah, it's definitely important for both. And I think the other misconception around iodine is that it's only for your thyroid health. And this is not true either. It's really important for immune function. It's important for breast health. It's important for detoxifying estrogen as well. So yeah, it's not just thyroid health. And so for some people who've had even a thyroidectomy, they think that they don't need iodine, but you still do. So yeah, there's a lot of misconception around iodine. So that is definitely one thing, to be working with someone who knows what they're doing and knows how to introduce it into your supplementation, and when to do it as well. And then keeping an eye on it, because some people, even though they're really, really depleted in iodine, they may have Graves and it's not at the right time for them to introduce it, and they can get a flare. And that's the same with Hashimoto's as well. Sometimes it can elevate antibodies temporarily, and so people start to freak out about that. But yeah, I just think the best advice is to be working with someone who knows what they're doing around how and when to introduce iodine.
Do you recommend iodine testing?
Yeah, yeah. Yeah, the urine testing.
Okay.
Yeah. Is
So
that what you do
you're
as well?
when I do iodine testing, yeah, I definitely find urinary testing to be more accurate than blood testing. And then there's like the patch test, which most people do the patch test. It'll disappear relatively quickly. So I was guilty of doing that or recommending that like years ago. But
Yeah.
yeah, if I recommend iodine testing, urine, I think is the way to go.
Yeah. Yeah. Yeah, and there's also testing for bromine as well. So there is a lab out here. You might have, I'm sure you probably have labs over there that test it as well. But because it's a halide, so we want to make sure that we're also looking at the bromine levels as well, because our halides like fluoride, bromine can affect the body's ability to uptake the iodine. So even though some people may, on a urinary iodine test, they may be presenting that they have enough iodine there, but they're not actually getting it because of the halides that they're exposed to through bromine or fluoride if they're drinking fluoridated water.
So I imagine you're recommending to avoid water with fluorine, toothpaste with fluoride, and try to
Yes.
minimize other halides like the bromide you mentioned, chlorine, maybe
Yeah.
install a shower filter.
Yeah. I mean, look, we can't do everything at once because, like, it's detoxing your lifestyle is a rabbit hole in itself. It's the same as trying to navigate your thyroid autoimmune journey can be a rabbit hole. This is why it's really helpful to work with someone that can just help you take it step by step. But yeah, that is very important. If you're going to invest money into your health, I would highly recommend at least starting with a water filter and getting rid of your fluoride toothpaste. Absolutely. Very important for thyroid health.
All right. So what are some other common oversights when it comes to thyroid healing?
Yeah, so other common things that I often hear is people saying, "Oh yeah, I tried the AIP diet, or I tried the paleo diet, or I tried this or tried that." But often people are not trying it for long enough. You know, you really need to be giving something a go for 3 months or three menstrual cycles um, to really understand if it's going to be helping you or not. Yes, if you have like major adverse reactions to something, like straight up, that might not be right for you. And just because you are following an elimination diet, it also doesn't mean that all of the yes foods on the list are going to be right for you as an individual. So, yes, it's important to listen to your body, but it's important to really give it that time and the consistency. So I feel that people aren't, like, they tried it, but they probably only gave it like 70% commitment. It's really important that there is a high level of commitment, being really consistent and giving it that the time frame.
I agree. I mean, there's some people, I mean, following a healthy diet, like you said, AIP or paleo for 30 days obviously is better than not following it all, but still I agree if it's best to try to do it for at least 3 months. I mean, sometimes it is a mental game where you have to tell yourself you're going to start out with 30 days, but inside kind of knowing that after that you hopefully will continue with that. And so yeah, definitely agree with that. And do you recommend then for most of your clients like an elimination diet, or do you recommend food sensitivity testing, or a combination of both?
It depends on the patient that's sitting in front of me as to their personality type. Some people, it would depend on what sort of elimination diet is what I mean by that, because the AIP diet is extremely restrictive. And for some people, it's very stressful to do that. And then that's counterproductive in itself because it's causing too much stress for them. So I do be a little bit more flexible. For some patients, I am doing more of a paleo style diet. But I also do testing for, I have a hair test that I do. It's a biocompatibility test. And so it tests for over 600 items and it gives you an exact list of yes and no foods for you as an individual. So for some patients, they choose that option so that they have an exact list to go by. And then it's just coaching them around how to really effectively create healthy meals, how to eat to optimize your digestion and getting your nutrients from your food. Um, yeah.
And so again, we both agree 3 months, sometimes longer, but let's say 3 months go by and someone's following, let's say a paleo diet, and just 3 months go by and they're really not experiencing any improvement in the symptoms, maybe even the blood tests haven't improved. So what would you be the next step for that person?
Yeah, so for that person, I'd be looking at other things like underlying infections, um, toxin exposure, looking at their stress levels, looking at their sleep, but also really looking into going more deeper into how they be as a person as well, like how they're managing stress, how do they think, how do they interact, how was their relationship with themselves, but also going even deeper than that and looking into trauma history as well, because what I believe that the root cause of any disharmony is what I call it, instead of illness or disease. Any form of disharmony, I really believe, is in the emotional body. And so how we have responded to things that we've encountered in life. So yeah, there's a bit of a list there. But yeah, I have a story of a patient who, she was doing all of the things. She was so consistent, so compliant, so committed, and things weren't correcting. She still had symptoms that just weren't correcting with her digestion. And so I needed to investigate further, and we did a gut test for her. And she came up with 4 infections in her digestive tract. So yeah, so it does pay to do further testing as well. So if you find that your symptoms aren't correcting, there are so many other aspects that we need to be looking at. And so, yeah, the gut health is a big part of it. And then, like I said, looking at the mindset and the emotional components as well, because we're a whole person. We're not just this physical body. We do need to look at all the physical aspects, but I do believe that we need to go beyond the physical aspects as well.
So you would agree then, based on what you said, that diet's important, but it's usually just a piece of the puzzle. Like changing your diet alone usually is not going to completely help someone with hyperthyroidism or Hashimoto's reverse their condition.
No, like, yeah, for some people, they might be really lucky, but it's not going to just be what you ate that caused your thyroid imbalance or caused a thyroid autoimmune. It's accumulation of many different components over time. So our health is accumulative. And so, yeah, while you will very likely reduce your symptoms by just changing your diet. Yes, because that was my story. That's all I did. And I didn't have anyone guiding me through the other aspects at the initial stages of my own healing journey. And so, yes, I did get my antibodies down, and they also went back up when I got stressed. And so I realized, okay, stress is a big part of it. And then through my journey, I realized, oh my gosh, there is so much more to this. I needed to really dive deeper into looking at my gut health further, looking at underlying infections, then going deeper again, like how I found out early on in the piece about the mindset stuff, because I had a breakdown in the supermarket, because I was like, when you have Graves, you are always hungry. And so you constantly eat 24/7, but you just never satiated. And so that was me. I was just wanting to eat, losing weight. And so I was at work, hadn't taken enough food to work. And I went over to the supermarket to try and get some food. And it was just like, there was nothing there I wanted to eat. And I was like, this is just frustrating. This is hard. And when I went home that night, I was like, okay, I can't have this perspective on my healing journey. I can't keep telling myself this is hard, this is hard. I need to be focused on what it is of the direction I'm moving in, and what's my goal? What am I moving away from? What don't I want? But what do I want? So I needed to get clear on that. And so I started working more on mindset. And then fast forward again, I realized, oh my gosh, I needed to look into traumas and life events that have happened that has caused imbalance in my system, in my energetic system, in my emotional system, that was contributing to an imbalance in my physical system. So yeah, there's a lot of different components to look at. But my advice is to take a step. Just take a step. You don't need to do all the things at once. In fact, I wouldn't even recommend doing all the things at once. It's overwhelming. So the physical body is a good place to start, because you will start to get symptom relief, and you'll start to feel better. You feel like you have more space and capacity to then start to look at other areas. Maybe your next step, you want to look at detoxifying your lifestyle, living a more low tox lifestyle. And then you might move into, I would probably do mindset near the beginning. That's what I do with my patients. But if you're not having someone guide you, that might be something you decide when you're going to introduce what, really, because you're the pilot of your flight. But yeah, I would definitely be looking at the mindset. And then when you have more understanding of how you operate, then you have more confidence and hopefully tools to be able to unpack what's in the emotional body.
So start with the physical changes, so diet, you mentioned mindset, and then maybe later on then incorporate more emotional healing.
Yeah. Yeah. I think that's the best way, because if you start trying to unpack some, emotional healing in the beginning when you're feeling really crappy because you've got an overactive or an underactive thyroid, so you could be anxious or you're depressed, it's not really the right time to be looking at all the emotional stuff. I feel like it's better to get your thyroid in balance first, start to reduce your symptoms, you start to feel a bit more like yourself, and then you have more capacity and energy, really, to be able to start to look at the emotional components. Because for some people, there's a lot there. A lot of my patients have very, very big stories, and there's quite a bit to unpack, and there's quite a bit of trauma. So yeah.
And how about you mentioned like the example where you did a stool test, you found the 4 gut infections. So is that dependent on the person, like the person's case history, as far as like when should they, I guess, consider doing a stool test to look at gut infections, for example?
Yeah, I think it's dependent on the symptoms that you're presenting with as well. Some people, they may have really extensive digestive issues, and so you might want to be testing much earlier on. But for a lot of my patients, I don't really need to do stool testing, because the process that I take them through to heal their gut works. But for this particular patient, it wasn't correcting, and it's not that she wasn't compliant in what we were doing. She was extremely compliant in what we were doing, very committed. And that's why I was just like baffled, as why is this one not correcting? Okay, we need to look further. So yeah, I think if you're doing all of the things and the symptoms are not correcting, then, look further. Or if you're feeling really horrible, like you have a lot of digestive issues, so you've got a lot of bloating, you have a lot of food intolerances, you've like got chronic constipation, or you've got loose bowels multiple times a day. So 4+ times a day, or maybe even 3+ times a day, and that's consistent every day. You might want to be looking into doing a gut test just to see what's happening there, because that's certainly not normal to have so many different digestive issues. I think for some people, if they've had digestive issues for such a long standing time, that becomes their normal. But it's not normal. I've worked with people that was like, oh, just my whole life, I've only had a bowel movement, 3-4 times a week. And I just figured that's just my normal. It's the same with, people who experience PMS. They just think that that's normal, and it's not. It's common, but it's not normal. So we want the body to be, you want to have a bowel movement every day, 1 to 2 times a day. And you don't want to be having PMS symptoms either. So when your body is in balance, you will be having regular bowel movements. You won't know when your period is coming. You generally won't have too many symptoms. Yeah.
All right. Well, thank you for sharing that. And anything else with common oversights that you didn't cover?
I don't think we covered it all. We talked about giving it enough time, being consistent, being compliant, the iodine piece, further investigation into, getting further testing. And we talked about the mental and emotional aspects as well.
Get into the compliance, so and getting better. Obviously, everybody's different when it comes to their healing journey, but what do you see as far as the timetable with someone who has, hyperthyroidism, especially Graves' disease, as well as those with Hashimoto's? Like I think some people have unrealistic expectations where, they might think they could get into remission within like 2 months, which is very
Sorry.
short period of time.
So I've just got the cat here jumping. I don't know what it's doing. It's jumping up on the door. So I hope we can cut
No,
those.
that's okay. Yeah, we could definitely edit this out. I have a couple of cats too, so
Ah,
so yeah,
the door's open, but I
edit.
don't know why he's doing that. He opened the door himself, and now he's anyway.
It's up to you. Do you want to take a break for a minute
No,
or
it's
we
okay. Do you want to ask the
okay.
question again? Because oh my God, what is he doing? Teddy, stop. There must be a bug on the wall or something.
Oh, okay.
He's like jumping really high. Do you want to ask that question again? Sorry.
Yeah, no, that's okay. Um, so when it comes to patient compliance, as far as the timetable for people to heal, because again, it does take a commitment, and some people I think have unrealistic expectations. They might think that within 2 months, especially if they have Graves, Hashimoto's, probably takes quite a bit longer to maybe not to start feeling better, but to actually reach the point of remission. So I guess what do you find in your practice with your clients as far as on average? Again, everybody's different, but how long does usually take for someone with, Graves' disease, Hashimoto's to get to the point where they're fully healed?
Yeah, like you said, the timeline. It's like, yeah, it is very case by case. I think for some people, they think, like, because I do a 12-week program, I think for some people, they may think, oh, I'm just going to do the 12-week program and then I'm good. And that's not the case. Like that first 3 months, that's why we say you need 3 months. That's where you really got to give commitment to really heal the gut and reduce inflammation. But that's only the beginning bit. What you do after that is so important as well. So it's like really looking into changing your lifestyle. It's like your lifestyle needs to change. What you did before you started on your healing journey, all of the different things that you were doing that contributed to you having this imbalance in your body, so having a thyroid condition, you can't go back to those habits. So it's about learning to change your lifestyle and your habits and your identity around who you are and how you view your health. So the time frame, I would say, for most people is at least a year, but for many people, it's a couple of years as well. I've had the odd patient who got into remission in 3 months, but that I rarely see that happen. Yeah, she was lucky. I shouldn't use the word lucky because I was very upset when my endo said that to me. You're just lucky when you change your diet. I mean, she was very committed, but she also didn't have a whole other lot of different things to be dealing with. She had already low toxin life, and yeah, I don't know, her body just corrected quickly. But yeah, I think you need to give it at least 12 months of reasonably high commitment. I feel like that first 3 months needs to be the highest commitment that you can give yourself. And then you can start to be a little bit more flexible and start to introduce some foods back in. But consistency is key. Like if you know that, like even now, me years later, I will not go off on like over Christmas and stuff. It's not like I'm going to go weeks and weeks of drinking alcohol every day and having sugar every day, or, eating gluten or dairy or something like that. It's not part of how I am. I've completely changed the way that I view health, and yeah, my identity just doesn't identify with that. We're talking about this with a client yesterday. It's like when you drive past McDonald's or KFC or any sort of fast food joint, I do not even associate that with food. Like there's not even 1% of me that would even consider to go in there, or to eat a pizza with gluten and cheese in it, just like that. To me, that is not food. I wouldn't eat, and you guys don't have Tim Tams over there, but I wouldn't eat packaged like biscuits, or like, if you go to your aunt or your granny's house and they have Arnott's biscuits. I don't know, these are like all Australian brands, but your biscuits there or something. I just don't even register to I have no desire to eat it, because I've completely changed my identity around how I view food and how I view what I do with my body. I see my body as my temple. So yeah, sort of a bit of a tangent there with that answer, but yeah, it's an ongoing thing to heal. But for you to reach remission, I can't give a time frame, but I would say for the average person, it would be at least 12 months. And then to stay in remission is that consistency and commitment and devotion to your temple, to your body. It really is a personality and a lifestyle shift to be healthy. It's not just I do it for a snapshot in time. Yeah.
I agree. I mean, I'd say, average 12 months. Again, everybody's different. So some people, might take longer than that. Some people maybe a little bit less than that. Yeah, 3 months. Yeah, yeah, that's like you said, rare, unusual,
Very
but yeah. And yeah, so it sounds like maintaining a state of wellness overall, still eating a pretty healthy diet, living a healthy lifestyle, which I do as well. Although I admit, I can't deny I do have sometimes cauliflower crust pizza. I can't say I'm completely pizza free.
Oh,
So
yeah. No, I do have different types of pizza. I just wouldn't sit down to a regular pizza with like heaps of cheese and just a normal gluten base.
mhm.
No.
Yeah, so you do indulge every now and then with different foods
Yeah.
also. So.
Yeah. Yeah. It was my birthday just last Friday, and I had sparkling red. So yeah, I drink alcohol, but I don't do it every week, and I don't even really do it every month. Um, Yeah, I mean, but not everybody, you get to decide what is your level of commitment so that you can still have balance in your life. Like if you come from a European background, say, family and food is like a big part of who you be, right? So much of their culture is around food and getting together with family, and you might just choose how you're going to navigate that. You don't want to completely not have those foods, or I don't know, like I think you just decide what is the right balance for you. What is your level of commitment? Is 70-30 where your balance sits for you once you've passed that main parts of your healing? So once you get past really the 6 to 12 months, you get to decide what your level of commitment is. I'm about a 90-10, but that doesn't stress me out, because my devotion to my wellness is my joy. I get a lot of joy out of being really healthy and looking after myself. But for some people, it's not like that. But what I would say to those people is, have a look at your identity. What is underneath all of that? Why do you think that way? Not that it's right or wrong, but it's interesting to look at, how we identify with health, how we identify with food. There's a big emotional component. So many people have an emotional attachment to food, and that's ingrained in us from childhood. You go to a birthday party and you're celebrating the birth of, this person's birthday, but look at the food on the table. None of it's food. So when we celebrate, we're putting poisons into our body. You do really well at school, and your folks are like, okay, let's go celebrate. We'll go to Pizza Hut. It's not like that's toxins, right? Or then when you get to an adult and you're like, oh, I've had a really like tough week at work. I deserve to have pizza, ice cream, and a bottle of wine because I worked so hard, or it was a shit week. But you're just punishing yourself even more by doing that. But we all have these patterns until we become aware of them. So it's like becoming aware of what is driving that. If I've had a really crappy week, yeah, my default might be to think, oh, I'm just going to crack a beer open or pour a glass of wine. But really, what do I need? So many people are afraid of connecting with their feelings. Can I actually sit with the feelings that are present? Can I actually make space for them to be felt, to be witnessed, instead of being pushed down and ignored? And then what do I actually need? Do I just need to have a good cry? Do I need to go move my body? Do I need to ask someone for a hug? Do I need to reach out to a friend because I just need someone to hold space for me and have a chat? Like really understanding what is it that I need and meeting those needs with something that is not food. So there's a lot to unpack when it comes to changing your lifestyle and changing your like resetting your identity of yourself. Especially when it comes to like wellness, because it has such an influence. Like how we respond to life really does have an influence over our physical body.
I agree with what you said. Thank you so much for sharing that. And I want to go in a different direction now. And maybe I should have brought this up in the beginning because this is really more about staying safe while restoring your health. So I think it's important to chat about this because, obviously, with your background, I mean, you help people get into remission, restore their health. But when you dealt with Graves, you did take the carbimazole, and a lot of my patients take anti-thyroid medication. It all comes down to risk versus benefits. And there are some people that absolutely don't want anything to do with the medication. Same thing with Hashimoto's. I mean, there's some people that should be on thyroid hormone replacement, don't want to be on thyroid hormone replacement. And when I dealt with Graves, I was able to avoid the anti-thyroid medication, but not everybody could do that. I mean, again, I do work with people who are on, in the United States, it's methimazole. I believe carbimazole actually converts into methimazole, so they're pretty similar. But was there any hesitation, like, at first when you took the carbimazole, or did you just, like, kinda, like, weigh those risks and benefits and said, "Really, I don't wanna take the medication, but, I know that, it's risky not to manage the symptoms," and knowing that you are also going to try to address the costs of the problem, which you successfully did at the same time?
Yeah, I guess this is a part of my story I probably haven't openly shared too much about. I do with my patients, but I don't think I have on a podcast. So when I was initially diagnosed with hypothyroidism, um, I mean, I was pretty unwell, but when I had that relapse 3 years later and was diagnosed with Graves, I was actually suicidal. And I thought, because before my initial diagnosis of hyperthyroidism, I had depression and anxiety, and I was on antidepressants, which I didn't want to do. But I had, quite a lot of stories and trauma to unpack from my childhood that I went and saw a naturopath, and we did like a whole 6-month detox before I went on antidepressants, and it helped, but it wasn't enough. I needed the antidepressants. But when I was coming off those antidepressants is when I got diagnosed with hypothyroidism. And so, I was a bit scared that it was me going off antidepressants. So anyway, I'm going to get to your answer of your question. So I did go on the carbimazole because I was just, I just had a lot of different symptoms. My eyesight was weird. I had heart palpitations. But when I had the relapse, like I said, I was very mentally unstable again. I thought that my depression had come back because I was off antidepressants at that point. And so I was seriously thinking to end my life. I planned it out how I was going to do it. And I went to see the doctor I was just like, I couldn't walk up a couple of stairs without losing my breath. I would go to the gym and my heart rate would go up to about 190 within 60 seconds, 60, 90 seconds. And I was like, this is not normal. Maybe I've got a heart condition. And so when they diagnosed me, the doctor said, look, all of what you're experiencing, you actually don't have depression or anxiety. This is a thyroid condition. So it's actually physiological and not psychological. She said, but don't worry, you will start to feel better like quite quickly. You do, like within less than a week, the anti-thyroid medication works pretty quickly. And so I started to feel so much better within, less than a week of being on the medication. So I think for each person, if you don't want to go on the medication, that's your choice. It's your body and it is your choice. but listen to what it is that your body actually needs. If you're like me and you're very, very mentally and emotionally unstable, then it might be a really good idea that you do go on the medication, even if it is for a short term, because you can get off it. As long as you haven't, if you have your thyroid removed, you will be needing to have medication. But when it comes to Graves' disease, like, if you've got really bad heart palpitations and things like that, that can be a risk. And I think it is important to go on the medication to be able to support your body to come back into balance, while you are also working on all of the other root causes. So, helping to support your body to heal holistically, and that will support you to get off the medication. But the medication in the meantime is going to help you feel some kind of balance. And so, yeah, that is my advice to any patients that come to me, is like, how are you feeling? I've had patients that have come to me that had T4 like so high. Like, I think she was like 80 something. And I was like, how are you sitting here normal, like not losing your mind? Mine wasn't that high and I really wasn't coping. I was crying every day. My coordination was off. Like, I did a chef apprenticeship, and I remember before I was diagnosed at my relapse point, I couldn't coordinate in the kitchen and I was cutting myself all the time. Like, I was just off. I had a rash all up my chest, right up to here, like all up my stomach and right up my chest. I wasn't sleeping. I was sweating in the middle of the night, and it was winter. But this lady who had T4 over 80, I was like, how are you? She just seems so normal. And I didn't get it. And so she was someone who didn't want to go on thyroid medication. And I supported her with that decision. And we got her thyroid back into range. So yeah, if it's something that you don't want to do, then do seek to work with someone holistically that is going to help your body heal holistically. But also consider that maybe it is something that you just go on short term, because you can get off it with the right support and putting the right steps in place. So yeah, I mean, listen to your own intuition. Your body, the body doesn't lie. Like, if you have such a strong aversion to doing something or not doing something, you've got to listen to your own internal guidance system. And I think that the practitioners that you work with are going to discuss the risks with you, but ultimately at the end of the day, it is your decision. Yeah.
Yeah, that is true. And thanks for sharing that. And I mean, the truth is that not everybody can manage their symptoms naturally. And even myself, when I dealt with Graves, I mean, I was open to taking the medication. I just made that decision initially not to do it, but it's not like I completely ruled it out. And if people are already taking anti-thyroid medication, whether it's carbimazole for those who are, in Australia or the UK, or methimazole for those United States, again, there is a risk to switch to the natural agents because they don't always work, like things like bugleweed or high doses of L-carnitine. Again, they can be effective, but I mean, definitely the medication is more potent. The challenge with anti-thyroid medication is it can cause side effects, and obviously, if someone's taking anti-thyroid meds and their liver enzymes are really elevated, or the white blood cell count is depressed, or they're having other symptoms, and then the medical doctor, the endocrinologist, let's say, is pressuring the person to receive radioactive iodine or thyroid surgery, then, in that case, yeah, you definitely want to look into alternatives. But if someone is listening to this and they're already taking the medication, they're tolerating it well, as long as you're doing things to address the cause of the problem, yeah, I agree. You don't want to get discouraged about taking the med just because you are keeping safe while you're addressing the cause of the problem. Whereas most people don't do that. They just take the meds and just pray they'll go into remission after a year and a half or 2 years. And obviously, since they're not doing anything to improve their health, a lot of times they will relapse.
Yes, and that is such an important point to speak to. Is that many people are doing the medication route with not doing anything else and wondering why they're not getting better, and they go back to their endo or the GP and then they up their medication, but it still doesn't work. Like, I'm particularly speaking to the Hashimoto's people, because they're taking thyroid hormone, and a lot of times they're on thyroxine, which is the T4 form, and it's not working. And so then their dose gets increased, but it still's not working, because the underlying drivers are not being addressed. And for a lot of these people, they're not being able to convert the T4 to the T3. And that's why they're still feeling crappy. And upping your medication isn't going to change that. It's your body is not able to convert it properly. Why? Or it's not effectively getting into the cells. Why? We need to look at that. And that is what is not being addressed in the mainstream. And people are being let down in that regard. So yeah, it really does pay to, just to be working with someone that is going to support you to understand how to approach your health from a holistic standpoint. Even if you only just want to do the physical aspects of it, and you're like, okay, I'm not looking at the mindset, I'm not looking at the emotional. For some people, they don't want to, or they're not ready to do that aspect. But I would encourage you to at least do the physical aspects and be supporting the body holistically, so that all of the systems within your body are working as best as they can be, that you're supporting those processes so that you can be converting your medication effectively and you can get the energy that you deserve to be having. And reducing those symptoms, and then like the hair loss aspect, you just taking thyroxine is not going to help your hair grow back. I'm sorry, it's not going to fix that. Just fix, like, even if you are converting it properly, you're probably still not going to get your hair to grow back effectively, because you need to be looking at other aspects. So yeah, and that is a common symptom, isn't it, with a lot of our thyroid patients, is the hair loss. And it's upsetting for women because we place so much emphasis on our presentation. Yeah, we don't want to be balding. So yeah, I just think, yeah, the holistic approach is so important.
No, definitely agree. And is there anything else that you want to cover? Anything I should have asked you that I didn't ask you, or maybe just if you want to summarize, like for those who want to know like where to get started. It sounds like, again, you mentioned earlier like the physical aspects, before getting into emotional healing. So anywhere you want to go, if you just want to summarize things.
I think another important piece is to learn to really advocate for yourself. I find a lot of patients, when they're going to see the endocrinologist or their GP, and they get shut down, they're not feeling heard, they're not feeling seen, they're not feeling understood, or they're told things like, oh no, we don't need to test your antibodies, or because, once they're high, they're always going to be high, or I don't test for iodine because I don't know how to interpret the lab results. I hear that a lot from patients, doctors. And just being really shut down in their experience. So it's just learning to really advocate for yourself. How you feel, it matters. What's happening with you, it matters. Your voice matters when it comes to your health. And if you're not getting the support that you know that you want and you need and you actually deserve to get, then I encourage you to find somebody else, like find another doctor to work with. So just learn to really advocate for yourself. And that is even with your holistic practitioners. There's holistic practitioners out there that aren't being fully supportive either, that do also shut down patients' experiences, or and I think also listening to your own internal guidance, no matter what, doesn't matter who you're working with. You need to listen to what is a yes or a no or a not yet for you when it comes to your healing journey. Like, really listen to your internal guidance as to where to next and who to work with next. And just because you've been working with one practitioner doesn't mean they need to be your practitioner forever. They might get you through this door and that door, but they may not have the key for the next door. And so you might need to go work with somebody else. And so listen to that as well. That's my advice.
All right. Well said. And Bronte, where could people find out more about you?
I hang out mostly on Instagram, so it's brontemay.naturopath. And same for Facebook, but I'm more so on Instagram. Oh, and my website is bronte-may.com. So bronte-may.com.
All right. Well, wonderful. I will make sure and to include those links in the show notes. And thank you so much. I mean, you shared a lot of great information. It was amazing having this conversation. And again, just continue keeping up the good work, helping others with, thyroid and autoimmune thyroid conditions.
Thank you so much for the opportunity to be here and to share this info with your audience as well.